We're talking about sleep disorders here at the Sleep Center with Dr. Hajal. Restless leg syndrome, is that a new kid on the block for sleep disorders?
Actually, no. It seemed like it was because there was a lot of awareness around the medications that were available around the year, I would say 2003 and so on.
Just that recently.
We had a lot of advertisement about it, but there are some literature that was found since the years 1600 and so on. Right, there were people describing those sensations, and so it's probably a very, very old old disease. It wasn't known, and it was frequently underdiagnosed. It still is, I think, and now we have much better options to treat it, though.
What are some of the symptoms?
The symptoms for restlessness of the legs are very typical, which means by just talking to the patient, we can make the diagnosis.
You can.
Exactly. There are 4 symptoms. One is that regardless of what the sensation that they have, is it numbing or is it pain, those could be a little bit difficult to identify. But there are 4 things that we ask them. One is that do you have an urge to move? Which means even if you have just numbness in the legs, and the legs are not pushing you to get up and move, it wouldn't be restlessness of the legs. Number 2, it would get better when you move, because many diseases that give you numbness in the legs would not. And if it does get better when you move, it's important. Does it get worse late at night is very, very typical also. Like the symptoms typically would happen at 10 p.m. as opposed to at 10 a.m. in the morning.
Okay.
And number 4 would be that it would get worse when you are resting, which means if you spend the day at the desk typing, it will be worse than the day you were jogging with friends. And this is quite typical also of the restlessness of the legs.
So if you are still or sedentary, you will feel it more.
It gets a little bit worse, yeah.
And if you run or walk briskly, you'll
right,
feel it,
and
or
if you do that at any time of the day, and then it'll manifest itself by having less restlessness of the legs at the time you go to bed, which is interesting.
So the more they move, the better.
Right. And those questions are typically to eliminate the other reasons why you get numbness in the legs, which there's so many of them. Neuropathy and vascular problems are the most common ones.
And you say that you can diagnose a person with restless leg syndrome just merely by talking to them.
They fit the questions, they fit the mold really well. That's it, we move on to treatment, actually.
And it really would interfere with sleep, wouldn't it?
Oh, it's terrible because you can imagine that it happens late at night, so it's the time when they want to go to bed. It would get worse when they rest, which means when they get into bed and they want to fall asleep, and all of a sudden they feel like their legs want to go, urging them to walk around and pace around.
They twitch, their legs twitch.
And they twitch, right, and they're unable to fall asleep. And this is the main important difficulty with sleep, is unable to fall asleep initially, as opposed to waking up at 4 o'clock in the morning. That rarely happens with the restlessness of the legs.
They simply can't get to sleep. And,
right.
And don't they also get kind of creepy, crawly feelings in their legs too?
That's true. And so the sensation could be creepy and crawly, and you can see those are vague terms, typically for restlessness of the legs, because people have a hard time putting them into words, and we found that creepy and crawly is what resonates with them.
All right, because, well, you get a picture, though, with creepy crawly.
That's true.
Thank you very much for that explanation.
Thank you.